Chapter 11, Muscles of the Body, Part 1. So, as I mentioned in the last lecture, muscles are arranged in such a way that they have these little bundles of muscle cells. These bundles are called fascicles. So a fascicle, surrounded by its perimysium, is the repeating structural unit within a muscle organ. Now, these muscle fibers can be arranged in different ways. For instance, the muscle fibers could be arranged in a circular formation so that they inserting into themselves. For example, the muscle going around the mouth is orbicularis oris. They can be convergent, where you have a very broad area of muscle fibers and fascicles coming into a narrow single insertion. So pectoralis major is an example of that. You can have parallel, where all the muscle fiber fascicles are running along the same direction and are about, the muscle organ is about the same length all the way, or width all the way down its length. So an example, sartorius muscle. You can have fusiform. Fusiform is like parallel, except the muscle gets wider more toward the middle. So again, all the fascicles are in parallel, but they get wider toward the middle. It's often referred to as the muscle's belly. So example, biceps brachii is an example of a muscle that's fusiform. And then unipinnate. Unipinnate means that you have a long, long tendon, and the muscle's fascicles are inserting into that tendon, so it looks kind of like a feather, the little fibers of the feather running along its length. Example of that would be extensor digitorum longus. We have bipinnate, where again you have a longer tendon and the fascicles are inserting into it, but this time on either side, on both sides, bipinnate. An example of that would be rectus femoris. And multipinnate means that you have multiples of the uni or bipinnate structures all inserting into a single tendon, just arranged like a bunch of feathers inserting into a single point. An example of this would be the deltoid muscle. All right. Again, origin, that is the immovable attachment site for a muscle, while the insertion is the movable attachment site for a muscle. So when the muscle contracts, it then moves the structure, in this case the forearm, and the movement is actually occurring at the joint. Some muscles can cross more than one joint. Most of them insert into bone, but some of them can insert into themselves, circular ones, or into cartilage or into skin, and in those cases there is no joint. The lever system is the physics concept of trying to use rigid structures to help move things. Our muscles act a lot like the lever system. So, for instance, you have the fulcrum. The fulcrum is the fixed point at which the lever is moving. For us, that is the joint. The joint is the fulcrum. The levers themselves are the rigid structures. So for our body, those are the bones. The load is whatever's being moved. So in this case, it's the forearm and hand and whatever's in the hand. The effort is the generation of force, the force that's going to move the load. And that, of course, is being generated by our muscles and the contraction of the muscles. A mechanical advantage means that the load is closer to the fulcrum, so that you don't need as much effort to move the object. That's usually in physics what you're trying to do is use less force to move something. However, in our muscle system, it's a little more complicated. You also have the mechanical disadvantage. It's the other side. The load is further away from the fulcrum than the effort. So now you need more effort, more force to be put into moving something of a certain weight. Now, there are three kinds of lever systems in our body. There are the first-class levers, where the fulcrum is between the effort and the load. So like a scissors or semispinatus capitis muscle, the effort, the head is, muscles moving the head. Here's the joint, fulcrum, and the load is the bulk of the head. There's second-class lever systems, where the load is between the fulcrum and the effort, such as a wheelbarrow, or say the gastrocnemius muscle pulling on the calcaneus, the load being the weight of the body, fulcrum being the ball of the foot. Third-class systems, the effort is between the fulcrum and the load. Here's the effort pulling on the rigid structure, trying to move the load, which in this case is fishing. Example like that is biceps brachii. Again, the fulcrum, the elbow, the effort of the muscle, the load of the thing we're moving. And this third class is actually the most common arrangement in the body. All right, usually our muscles are arranged in antagonistic groups. Antagonistic groups have the prime movers. The prime movers are contracting to generate the force to move something, and opposing them are the antagonists, which have to relax and stretch to allow the movement to occur. Now, let's be honest, they're not actually fighting against each other. It just means that one set of muscles does one motion, the other set of muscles does the opposite motion. So one set has to contract, the primary mover, the other set has to relax, the antagonist. So in this case, when flexing at the elbow, the biceps brachii would be the prime mover, triceps brachii would be the antagonist. Additional muscles can come into play to aid the primary mover. They're often called things like synergists or fixators. They help to either increase the force of the effort to move the structure, or maybe they're just stabilizing the movement. So it's a nice smooth movement. There's no shaking or whatever. All right. The muscles can be found on the interior side of joints, the anterior side, so biceps brachii on the interior side of the humerus, and they often cause flexion. Flexion at the elbow, flexion at the shoulder, so pectoralis major will cause flexion at the shoulder, anterior side. Posterior side muscles tend to cause extensions. So again, latissimus dorsi, when it contracts, will cause extension at the shoulder joint. So flexion anterior, extension posterior. Exceptions for the knee and ankle, they're reversed. Muscles on the lateral sides often produce abduction. So deltoid muscle connecting to the humerus can cause abduction of the arm, shoulder. Muscles on the medial side can cause adduction, pulling down. So again, teres major pulling down on the humerus at the shoulder joint causes adduction. All right, muscle names. Muscles are often named in ways that may seem confusing, but in theory, the names are supposed to provide you with some information. So for instance, location, biceps brachii, brachii for upper arm, shape, deltoid, deltoid shaped like a triangle. Relative size, gluteus maximus, which is bigger than medius, which is bigger than minimus. The directions the fascicles are running, so rectus means along the, or parallel to the midline. Location of attachments, telling you where their origin insertion is, brachio radialis, so brachios radialis, the radialis means radius, so it's attaching to the radius as its insertion. Number of origins, triceps brachii, three origins, and the action. Adductors tend to adduct, flexors tend to flex. So be aware of those naming conventions. All right, starting with the muscles that are involved in facial expression. We have epicranius. Epicranius, as you can see, goes all the way around from the back of the skull around the top to the front of the skull. The frontal belly in the front, the occipital belly in the back. Epicranius inserts into skin, and when it contracts, it leads to raising of the eyebrows. So that's what epicranius does. Buccinator. Buccinator is a deep muscle on the sides of the cheeks. It inserts actually into skin. And when buccinator contracts, it compresses the sides of the cheeks. Could be useful while chewing, to move food around. Could be useful for whistling. Then we have orbicularis oculi around the eyes and orbicularis oris around the mouth. Orbicularis oculi allows for you to close your eyes to blink. Orbicularis oris allows you to close your mouth. If you contract it enough, you can actually push out your lips to give you that kissy face that 2-year-olds love to give, and also helpful for speech. Zygomaticus major also inserts into skin. Zygomaticus major inserts to the corner of the mouth, so that, as you can see here, so that when it contracts, it helps to raise the sides of the mouth to let you smile. Temporalis is a large broad muscle on the lateral side, inserts into the mandible. Masseter, another broad muscle, also inserts into the mandible. So both of them elevate the mandible. So they raise the mandible up, allowing us to close our mouth, which can be useful for closing that jaw to engage in chewing. Moving head. Well, muscles for moving the head include sternocleidomastoid, this broad muscle on the lateral sides of the neck, going from the mastoid process temporal bone down to the sternum and clavicle. So it's origin, sternum, and clavicle, inserts into the temporal bone, allows us, if both muscles on both sides contract at the same time, to flex the head, to look down, as it were. And if you just flex one of them on one side, it can allow for lateral flexion, sort of bending the head to one side. We have splenius. Splenius muscle is toward the back. Its origin is on the vertebra, inserts into the occipital bone. When you contract splenius muscles together, you extend the head, so you contract the back muscle so your head is now looking up. And if you just contract one of them on one side, it'll help to rotate the head. The diaphragm. The diaphragm is the sheet-like muscle that separates the thoracic cavity from the abdominal cavity, and its critical function is in breathing. When the diaphragm, sort of bowl-shaped, contracts, it actually flattens out. As it flattens out, it helps to stretch the lungs, causing inspiration, causing air to enter the lungs, basically by decreasing, this is typo, decreasing the pressure in the lungs so that air will flow into the lungs. All right, other muscles, muscles of the abdominal wall. We have rectus abdominis. These are two sheet-like muscles, rectus abdominis. They're toward the front, and they compress the abdomen and also can help to flex the vertebral column, allowing you to say bow. Their origin is the pelvic girdle, and their insertion is into the sternum. Then we have the external obliques. They're on the lateral sides of the abdomen. Their origins in the ribs. They insert into the linea alba. Linea alba is this sheet of connective tissue right down the midline. And the external obliques help to compress the abdomen. This is important for doing things like coughing or maybe singing or sneezing or defecating or urinating or childbirth. Lots of times when that's an important thing to have happen. Again, here is sort of the arrangement of the abdomen. So we have the external obliques on the lateral sides. They form this sheet of connective tissue that then comes together on both sides to form down the midline, what's called the linea alba. Linea alba, fusion of the aponeuroses, the connective tissue coming from the external oblique, right down the midline. For rectus abdominis, we have these little tendinous intersections that are lying on the surface of the rectus abdominis muscle. They basically limit where the muscle can get bigger. So someone with six-pack has basically caused hypertrophy, increased in size the rectus abdominis in these regions, but can't do that where the tendinous insertions are. If they did not exist, then when someone worked out really hard to develop their abdomen, they'd end up having a more barrel-shaped belly. But because the tendinous intersections are there, instead we get a six-pack. Well, they get a six-pack. Also, we have the internal oblique. The internal oblique is underneath the external oblique. And then deep to that is the transverse abdominis. So there's actually three layers on the lateral sides, the external oblique, the internal oblique, and then the transverse abdominis. Very thin muscles. They're involved in compressing the abdomen. Again, the internal oblique, its origins the pelvic girdle, inserts into linea alba. Transverse abdominis, its origins in vertebra, and it inserts into the linea alba. And that is it for this part of the lecture.